My name is Paul Letendre. I'm a medical oncologist hematologist here at Gunderson at the Cancer Center. My approach as a physician in oncology is kind of threefold. First and foremost is patient care, and with that, the care of their loved ones and family who join with them. Cancer is quite a large, potentially life-altering diagnosis, and most of my daily activity revolves around meeting the needs of patients, both in mind, body, and in spirit, however I can help. Each patient has a lot of unknowns, questions, uncertainties that they may have, and so first and foremost, it's really patient-centered care. Secondly would be education, providing education to patients themselves about new therapies and what's coming up, what we can and can't do, as well as education to their family members. Our role as physicians is really to provide education for our patients and their loved ones, and for them to be the ultimate decision makers. Also, we have learners and are training young physicians at the Cancer Center, and so that provides an opportunity for ongoing learning and to stay relevant and up to date. And lastly, research. Particularly in the field of oncology and cancer, things are growing very rapidly with new therapeutics coming out on what seems like a weekly basis. And we need to be part of that and current with everything. And so a key foundation in research is important as well. I think my favorite part of being a medical oncologist is the relationships I've cultivated. Firstly, with patients and their loved ones. This is a journey we go through, oftentimes a life-altering journey. And when patients come in, there's fear of the unknown and what it is, and it's very rewarding to be able to establish a rapport with a patient, get to know them, know where they're coming from and their family. And then, in an ideal world, years later we get to see them in follow-up, and those relationships really grow. I get to see parents watch their kids graduate, or grandparents get to go to their children's weddings, and that's really impactful. And then, of course, there's the interdisciplinary team and the relationships I've made at the hospital. Here at Gunderson, we have a whole interdisciplinary team made up of radiation oncologists, medical oncologists, surgeons, therapists, nurses, pharmacists, and I interact with each of them on a daily basis with patient care. And so those relationships are very important to me as well. My decision to go into medicine was actually a little later than most people. I sustained a pretty significant injury in my early 20s and ended up being in the hospital for a prolonged time, requiring several surgeries. And during that time, I was just in awe and mesmerized by how well everyone worked as a team, from nurses to therapists to doctors, all communicating and working for the common good, which in this case was me. And so I was really drawn and attracted to that part of medicine, and so since then I've always wanted to be part of the team. I think having been a patient, I do understand some of the intricacies of what you need. It's not always, oh, my foot hurts. Sometimes it's just knowing the doctor or the nurse took a minute to listen to you, or someone went that extra mile and brought you something extra that they didn't need to, something to read, an extra chocolate milk if you're thirsty, any of those things. And it's within the detail as a patient that you really start to notice how much people care and are truly here as a vocation and in a desire to help you, the patient.